So basically, in assembling a comprehensive care team, we would include Western medicine and Chinese medicine in HIV. In terms of Chinese medicine, remember Chinese medicine, has a huge number of possibilities and capabilities. The very first thing that we talk about is evaluation. Evaluation, obviously evaluation and determination of diagnosis is number one. Obviously, we can't do any of the rest of it without a correct diagnosis. And, I think that there's a number of physicians who say that, 90% of Chinese medicine is diagnosis and pattern differentiation. And the rest is all just flows from that. Acupuncture, Moxibustion, Chinese herbs, Qigong, exercise, and professional massage are certainly all parts of Chinese medicine and something that we use every day in the clinic with people with chronic and severe disease. So in terms of evaluation, here we are. Our main form of herbal medicine is looking at the tongue. And a very important part, obviously we don't just look at the top of the tongue, we look inside the mouth, we look under the tongue, we look at the veins, tongue diagnosis is something I spend a huge amount of time with, and I feel like it's an important area. And, people can ask more questions about it, but I think that's something that hopefully all of you who are herbalists are using tongue diagnosis as the predominant way to, especially for TCM herbal medicine, using tongue diagnosis as a predominant way of giving herbs according to the Chinese differential diagnosis. So in terms of we've got the Western baseline, I already mentioned that. And then Chinese medicine evaluation, again, acupuncture. Whoops. Obviously, you know what acupuncture looks like, but I'll show you acupuncture in the clinic. There's obviously we do body acupuncture, lots of ear acupuncture that we can do. And I find that many of the symptoms that we can treat, we can also work with people who are dealing with drug addiction through harm reduction techniques and using acupuncture as part of that. Obviously, here we go with more body and ear acupuncture. So actually this is an interesting one because we use electroacupuncture quite a bit. We use it in HIV, particularly people with HIV are much more susceptible to Bell's palsy than people without HIV. Bell's palsy appears to be a viral-related problem from a Western perspective. However, I always see it as wind. I pretty much guarantee you that I can ask somebody if they've been exposed to wind and cold, and that's usually who develops Bell's palsy. However, we see this regularly for people with HIV, and they have often more difficulty in dealing with Bell's palsy. But we'll use electroacupuncture in that case. We also use electroacupuncture. A lot of people with HIV also get shingles, herpes zoster, and so we will use a surround the dragon with electroacupuncture as well. Next, Moxibustion is actually a very important part of HIV treatment. I learned Moxibustion before I learned acupuncture. I was a shiatsu practitioner before I was an acupuncturist, and I actually learned from a master acupuncturist I didn't know at the time in New York City, Dr. Nakamura, and he trained us in Chinese medicine as well. And I learned Moxibustion very early on, both Japanese and Chinese style Moxibustion, and I find it to be highly successful, especially in many of the symptoms of spleen and stomach qi deficiency that are found in HIV. There's lots of forms of Moxibustion, clearly. We can use stick Moxibustion, we can use Moxibustion in the navel, we can use the stick-on moxas, so lots of different ways in which we can use moxa. Here is one of my favorites, naval Moxibustion with salt. The way that this is done, if you look at this, I don't know how many of you are actually using this in the clinic. I have found that most practitioners don't use it, but I like to encourage people to do it. But you do have to hang out with people when you do it. But we use salt, and I like to use kosher salt, and it has nothing to do with being chicken soup Chinese medicine. It has to do with the nature of the salt. And I don't like to use any salt that has dextrose in it because then it starts to get sticky and starts to burn when you use the heat. So you want to use a sea salt or a natural salt or kosher salt, which is what I use. And we'll fill the navel. And I use futsa, aconite. You know, I learned really, really early on about making little cookies that you can put on the navel. You know, if any of you are aware of this book, you can take cinnamon and other herbs and you can make cookies that also have futsa and put them together with flour and bake them. And that's actually a way to create a very warming herb that you would use over the navel and on other areas of the body. But it takes a very long time, and you can spend a day or two making those. So I wanted to figure out an alternative to that a long, long time ago. And I said, you know, I think futsa might be actually the best thing. And so we can get really nice we can get futsa raw and, prepared, I don't mean raw, but prepared futsa aconite, and just make sure that it's a large enough size, and then you can just place it right on top of the salt. And then we place good, you know, a cone of moxa, which is what we have here. We have a cone sitting on top, and then we burn the cone on top of the futsa. I don't use ginger. I know that's a question that many people have. I don't use sliced ginger. In this particular case, sliced ginger is great for other kinds of dermatological problems. But in this case, what we're trying to do is use the warming nature of the futsa to consolidate the moxa and to keep the warming and going deeply into the center. Because what we're trying to do is actually strengthen the yang and warm the center, you know, with this particular treatment. Also, when I light the moxa, I don't do it from the top, I do it from the bottom. And so that way the person gets a very even moxa treatment throughout the course of the treatment. And I use anywhere from 2 or 3 moxa cones to, I've had people with HIV who've been so very, very, very cold, severe watery stools, who I've had to use up to 40 cones of moxa before they feel the warmth. And so I use the moxa until they feel the warmth. So anyway, just some good technique, I think, with moxa. And then Chinese herbs. I have a whole raw herb pharmacy that I use in my clinic, as well as herbal pills of various sorts, herbal pills and tinctures and some powders. So Chinese herbal medicine for HIV and AIDS, I'm not going to give specific formulas or specific companies here. However, in Chinese herbal medicine for HIV and AIDS, what's really important is that these are the concepts that need to be used. I can talk much more about the concepts. So the main concept is immune modulation, not immune strengthening, but immune modulation. And because a lot of times in HIV, people not only have immune deficiency, but they'll also have autoimmune responses. And so one of the things is, for example, I think, while we talk here about tonifying the qi and shui, jing, yin, regulating qi and vitalizing shui, also, Fuzhong, you're going to have to pronounce this for me, Fuzhong therapy, which is restore the normal therapy, is what has been developed in China since the early 1970s for cancer treatment in China. And we adapted this treatment in the early 1980s for HIV. Fuzhong therapy, which was developed, is actually very important. And so I think for those of you who are not aware of the whole concept, there's a number of herbs that are within the category, which include huang qi, ling zhi, a number of the mushrooms, cordyceps. We also include, a number of the strong qi tonic herbs are part of it. Many of the mushrooms, Baimu Tremella, is part of that group of herbs as well. And so formulas can be developed. And so one of the things is, I've worked with designing herb formulas over the years, And those are some of the main herbs in the formula. So I find that some of the main herbs that we can use in the formula is like Lingzhi, Bai Mu'er, Wang Qi. So those would be some of the main herbs. Now, a lot of times people will come into the clinic, and clients will come in the clinic and tell me, oh, I'm taking Wang Qi. What do you think about that? I'm taking astragalus. And I say, well, that's one thing you can do, but it's probably not a good idea to be taking Wang Qi or astragalus by itself. Because what can happen with Wang Qi is it actually can cause too much congestion in the center when it's used by itself. And so we might get a lot of qi stagnation, and people start to get stomach aches and stomach pain when they're using Huang Qi by itself. And so I don't like to use, I like to discourage people from doing that, because they're told by their Western practitioners and Western herbalists oftentimes that they should just go and take astragalus. So I'm sure many of you have heard that if you're working with people with immune deficiencies. So I think we can get back to the question about the Lingzhi at this point, and what the preparation might be. I think Lingzhi is actually one of the herbs that sometimes people are able to use by itself, and can be used for people who have fatigue. I actually prefer cordyceps oftentimes, because one of the things about cordyceps is it's a true immunomodulating herb. And so cordyceps is one of the herbs that's used regularly when people have had transplants. And so it can be used in for example, when I see people who have had liver transplants or kidney transplants, we've been able to talk with the Western physician and say, look, cordyceps is going to be something that's going to be very, very helpful for the person in terms of their fatigue levels. And are you okay with the safety profile of cordyceps? And generally, they tend to be. And it's a really important herb in the Fuzhong it's not a category, but the Fuzhong herbs, which is part of qi tonics generally. So we also, remember we talked about toxic heat, and another category of herbs that are very, very important in HIV and development of formulas are clear heat, clean toxins. We will often use herbs like Bambangan, Dachini. Even extracts of those herbs can be used in pill formulas. And so there are a number of there are formulas that include those type of herbs. Jininwa can be used in the formulas as well. So a lot of times what I think about when putting together an herb formula is, while there's a lot of clear heat clean toxin herbs, there's only a certain number that seem to have specific anti-HIV effects or anti-HPV effects or anti-viral effects of viruses that are associated with HIV or often co-infections with HIV. So you might choose the Chinese herbs according to the diagnosis, the pattern differentiation of the person, and then compare that to the herbs that are also part of, that have been tested from Western science perspective, and put those two together and then create formulas based on that. Anyway, so that's kind of how we look at clear heat clean toxin. Then there's herbs for pain syndromes, and there's herbs that strengthen the marrow. One of the main herbs used for strengthening the marrow is used in chemotherapy, but we also use it regularly for people who have, basically AZT is a type of chemotherapy, and it causes a suppression of the bone marrow. But there are drugs that suppress the bone marrow, and also HIV itself suppresses the bone marrow. So you'll see people who have lowered white blood counts and lowered neutrophils, and sometimes anemia that we want to do some marrow strengthening. And so we might use Jishui Tong. Spanthologus is a great herb to have as a main herb in a formula for marrow strengthening.